Welcome everybody to our Thursday afternoon work session on the supplemental budget. I'll start over on my right and have committee introduce themselves.
Thank you, Mr. Chair. Good afternoon. I'm Representative Annie Graham. I serve the people of North Yarmouth and the majority of Gray, House District 105. And actually, I think it's above freezing.
Good afternoon. I'm Representative Lucian Daigle, and I represent House District 1, where we're going to have a dog and pony, just a dog show.
Dog race.
This weekend. And I don't want to hound anybody about it, but it'll be an awesome event.
Hard to follow there. Good afternoon. This Flavia De Brito, represent House District 64, part of Waterville and part of Winslow.
Hi, everyone. My name's Sam Zager. I'm honored to represent District 116, which is off Peninsula, part of Portland.
Michael Lemlin, represent House District 53, Chelsea, Randolph, Pittston, and Dresden.
Hello, everyone. I'm Ann Fredericks. I represent House District 143, and that's San.
Hi, I'm Representative Dan Shigori. I represent House District 55, the communities of Hollowell, Manchester, and West Gardner.
Good afternoon. My name is Julie McCabe. I represent District 93, part of Lewiston.
And Representative Griffin.
Good afternoon, everyone. My name is Abigail Griffin. I represent House District 34, which is Glenburn, Levant, and Kudeskaig.
Hello and welcome. I'm Representative Michelle Meyer, serving Southern Maine's District 150, which is all of Elliott, where I live, parts of Kittery and South Berwick, and I'm honored to serve as this committee's House Chair.
Good afternoon, everybody. I'm Senator Henry Ingwersen. I represent Biddeford, Arundel, Dayton, Hollis, and Lyman in Senate District 32, and I'm pleased to be the Senate Chair of this committee. I'd also like to give a shout out to our analyst, Sam Seneff, today, and to Sophie Duby, our clerk. Thank you for being here and thank you for your service. And today we'll start it right off with Sam.
Okay. So on Tuesday, we had the initial review of the governor's proposed supplemental budget for this year. So today you'll be really starting to vote on the initiatives that are outlined on your green sheet and on your purple sheet, as well as anything else you might like to recommend to the AFA committee as they consider the supplemental budget. So how would you like to do the votes? Do you want to do blocks of voting or, okay.
Yeah.
I think that works.
can.
Yes, don't you?
Yeah.
Yes. Yeah.
And I'm just going to jump in here and have Senator Moore introduce herself.
I tell you, I need roller skates around this building. Good afternoon. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County and 16 communities in Eastern Hancock County as well, down East Maine. And I've been in Marine Resources, so I apologize. I go from one committee to the next.
I hope you bring roller skates before she leaves. I hope you bring roller skates before the end of season. I want to see that. I'm going to need it.
Yes, Senator Representative.
Thank you. I have a question relative to a question I raised at AFA to the acting deputy commissioner, and we got a report of responses and answers, and my question wasn't fully answered. So I was hoping to ask before we get into voting on the budget.
Does it pertain to one of the line items we'll be approaching and voting on?
Yes.
I would say, can we get to it then?
It's not a specific line item. It's relative to the vacancies and how that unencumbered position money is handled.
Okay. Yep, go ahead.
So could the acting deputy commissioner come up?
Can you give us a reference page, please?
So it's not a reference page.
It's an answer to a question.
So the question is, I had asked while we were seated before AFA, the acting deputy commissioner, about the number of vacancies, the timeline of which the vacancies existed. Because to my understanding, some of those vacancies have existed for years. But here's the question, the direct specific question, sir, and thank you for coming before us. It's my understanding we have 408 vacancies. And my question is, are the funds that are assigned to those unencumbered positions, those vacant positions, returned at the end of the year, or is it used for discretionary spending?
So thank you for the question.
Would you go ahead and introduce yourself?
Yes,
Thank
good afternoon. Todd Haber, Acting Deputy Commissioner of Finance for the Department of Health and Human Services. So positions in a general fund account, those unused funds, those unspent funds will lapse back to the big state general fund at the end of the state fiscal year. The only exception to that is the hospitals, Dorothea Dix and Riverview Psychiatric. Those funds in two of their accounts do carry from year to year.
Very much so.
Thank you. Okay. Thank you so much for coming up and explaining that to us. Go ahead, Sam.
Okay. So I can group kind of like things together for voting purposes, if you like.
Yeah.
Does that sound like an efficient way to do it?
Yeah.
Okay, so we'll start at the very top. So this is line 1. This is the Riverview Psychiatric Center initiative to reduce funding due to the facility security being moved to DPS, Bureau of Capitol Police. And there was a question about that move, and that was addressed in the memo. Find it. It was the. This is on it's not numbered, but 1, 2, 3, 4.
Question number 11.
And so it's it's on the 10th page, question 18.
18.
Yeah. So the department does provide more information there. I can read that out loud if that is helpful. Okay.
Yeah.
So the question was, please provide additional information on this initiative. That's how many Capitol Police officers support this work? Is this cost neutral? And is the level of service changing? If so, why? The department wrote, this initiative moves general fund from the Riverview accounts where it is appropriated to the Department of Public Safety so that the positions can be funded in the most direct and appropriate way. The transfer of general fund in FA 1407 continues to support a total of 5 positions, 4 Capitol Police officers and 1 sergeant. The companion initiative in the DPS requests a total of $784,902, which is the net request of the general fund, $281,347. For over a decade, DHHS has had a memorandum of understanding with DPS regarding services at Riverview. When the original arrangement was established, officers were required to have a 24/7 presence at Riverview and respond to code calls. Since the original agreement with the Capitol Police, significant work has been completed to improve the milieu, I cannot pronounce that word. You can read it, milieu, and regain CMS certification, which had been lost over a decade ago. Importantly, Riverview has adjusted processes for responding to acute patients and dangerous behaviors. At this point, a fee-for-service relationship with Capitol Police is much more appropriate to meet the hospital's needs. This will be established through an MOU for transportation of legal hold patients for emergent medical issues and appointments, and occasional transport back to the county jail when the county is struggling to do a discharge transport. The Capitol Police would still respond to emergency calls like they would for any other state building in the Capitol area. That is it for that one.
I move that, I'm trying to figure out which, what was that? FA. Just use the
Is it
line.
line?
Just
the lines.
So I'm
good.
sorry, I move line 1 be moved into the budget.
And 2.
And
1 and
And
2.
2.
What?
It's with line 2 as well.
Thank you, sorry.
That's all right. Go
I'm the
ahead.
first to go. We'll all
Yeah,
get
put
it
your
done.
mic on.
Make that motion. Put your mic on.
All right, I'm here now. Thank you. I motion lines 1 and 2 be moved into the budget.
Second.
Representative Daigle, all those in favor? Okay,
All in. All right, we're on line 3. So this is for the mental health services, this is a transfer and reallocation of 1 social services program manager, 1 position from mental health services community general fund to behavioral health federal block fund. And that's kind of a standalone too.
Oh, the standalone.
Because they're different programs, so I'm not sure if you wanted me to just,
we can vote it separate.
okay, all right.
We have a motion on this one, line 3.
I'll make a motion to move lines 3 and 4 into the budget.
3 and 4. We have a second by Representative Daigle. All those in favor? Did we get Representative Lemelland's vote?
I'll do it afterwards.
Okay.
Okay. All right, line 5 and 6 transfers and reallocates one social services program manager position and one public service manager position 3 from the general fund to other special revenue in the Housing First program.
Okay. We have a motion for lines 5 and 6.
Yep. Yeah, I would move lines 5 and 6 into the budget.
Second by
So I'll be back.
Second by Representative Zager. All those in favor?
What's happening here?
I don't know.
So-
if we can get any-
Oh, he didn't see the count?
Can we just have
Okay.
hands again?
Are we-
Sorry. So, okay.
Is that unanimous?
And Senator Moore voted yes before she. All right. Next we have, lines 8 to 9.
Line 7?
Line 7, I'm sorry, line 7, 8, and 9. This provides funding to achieve parity with Medicare cost of living adjustments for certain community behavioral health related services. So this is for sections 13, 17, 65, 97B, 97D, and 97E for uninsured client. Sorry. Yes. Okay, cost of living adjustments for those sections.
Okay. Good. I have a motion. Representative Fredericks.
Thank you, Mr. Chair. I make a motion to move items 7, 8, and 9 into the budget.
We have a second?
Second.
Second by Representative Shigori. All those in favor?
Is that unanimous?
Unanimous, I believe. Haven't seen Mary Ann's
Did
vote.
somebody?
Hmm?
So- Was that unanimous?
It was. Yes.
Okay.
Yes, sorry. All right, line 10, residential treatment facilities assessment. This adjusts funding to align allocations with projected expenditures and available resources. And again, as Mr. Haber explained, this is related to the revenue forecast.
Mhm. I would move line 10 into the budget.
Second? Second by Representative Zager. All those in favor? Got unanimous.
The next two lines are both one is the line 11 is a reclass for a social services program manager 1 position to a social services program manager position in childcare services program retro to February 27th, 24. And that one we should probably do by itself because it is an employee initiated reclass. I believe there was a question from Representative Thumlin regarding this, and that is, I saw it here. Yep, it is number 40. And so the department provided the job specifications for each of those positions, which describe the different duties associated with the scope of work for those positions.
Okay,
We all set?
it's just line 11.
Yes.
Okay. I would move line 11 into the budget.
Second.
Second by Representative Brito. All those in favor? Unanimous.
Right. Lines 12 through 15. This is OCFS. It's a social service program specialist 2 position, and this is changing the way that position is funded from 81% general fund, 90% federal to 72% general fund, 28% special revenue fund.
Okay. A motion for 12 to 15.
Yeah, I would move lines 12, 13, 14, and 15 into the budget.
One second. By Representative Graham. All those in favor? Lines 12 through 15.
Roughly 15. No, I'm sorry, I've got to catch my breath.
That's
Go
okay.
ahead.
We'll go ahead and vote it.
Okay.
Your hands again? On 12 through 15?
12 through 15. I'm fine with that.
Okay.
Okay.
Get a count. And did you get a count, Sam?
Yeah. I got a
Okay.
count.
And opposed? Okay.
Line 16 through 18, OCFS is the reorg of a nurse 3 position to a child protective services nurse consultant position. And it transfers and reallocates the position from 100% mental health services general fund to 72% general fund, 28% special revenue fund.
Okay. That's 16 through 18, Sam?
Yes.
Yeah. A motion on 16 through 18, Representative Zager,
Thank you, Mr. Chair. I move lines 16 through 18 into the budget.
second by Representative Daigle. All those in favor? Will be unanimous.
Page 1. Okay, so this whole page are various changes to funding in roles. Do you want to just do this whole page together? I don't know if anybody has any different voting they would like to do on any of these, or if we can just vote this page.
I would like the ones that are establishing separate from the transfers and reallocation.
Okay, sure.
Person.
All right, so we'll do 19 and 20, which establishes one child protective services K-SAVE position, funded 79% general fund, 21% other special revenue funds, and this is to support the psychotropic medication settlement, which is also described in your memo. There was a question about what that was. That was CERD. $29. Question 29. I can read that quickly. That the question was to provide information about the psychotropic medication settlement, which was is referenced in these initiatives. In November 2024, the court approved a settlement agreement regarding a 2021 lawsuit against the department. It requires DHHS to put in place updated policies and procedures regarding the oversight and administration of psychotropic medication to children in foster care in Maine. These policies and procedures will, for example, improve medical and mental health record keeping and sharing, ensure that children ages 14 and over provide informed consent for psychotropic medications, and create a review process with a clinical review team to review certain psychotropic medications before and after they are prescribed. Department's progress in implementing these processes will be monitored and reported on by a third-party implementation reviewer. The agreement will remain in effect for 5 years from the date the implementation reviewer's contract begins. DHHS made an award for the position, but it was appealed. They have reissued the RFP. Accordingly, the 5 years is not yet started, but the department has created the required policies and forms. Those positions requested are to help ensure the department can meet the terms and performance of the settlement agreement. And they did provide a link for you so that you could review the settlement agreement should you wish. So
Folks okay with just moving through all the established in one block and then voting them?
Yep, so we could do lines
19 to
19 through
22.
24.
Okay.
24.
Those
Okay.
are all related to positions established for this purpose.
Okay, so I'll
Okay.
move those in. So I'd like to move lines 19, 20, 21, 22, 23, and 24 in.
Do we have a second on that?
Second.
Second by Representative Graham. All those in favor? Is that unanimous?
Good. Next, we have lines 25 through 27, which is a transfer and reallocation of a procurement and program administrator position from the early childhood consultation program general fund to 72% general fund and 28% special revenue fund. And that would be lines 25 through 27 rather.
Okay. Let's go ahead and do 28 through 30.
Okay, and similarly, 28 through 30 transfers and reallocates one social services program specialist to position from 72% general fund and 28% other special revenue in the Office of Child and Family Services Central Office to 50% general fund and 50% federal block grant funds.
Okay.
Next page two. Oh,
You have one more?
and Rob
Next
is
page.
just bringing my attention, it goes through 31.
Okay, got it. I have a motion on 25 through 31. Representative Zager.
Thanks, Mr. Chair. I move lines 25 through 31 into the budget.
We have a second. Representative Daigle. All those in favor?
Next, we have lines 32 through 35. This is an approved reorg of 3 social services supervisor positions funded 79% general fund, 21% other special revenue in the Office of Child and Family Services District Program, and 6 social service supervisor positions funded 70% general fund, 30% other special revenue fund in the state-funded foster care adoption services program to a social services program specialist 2 position. And this is retroactive to February 23rd, 2024.
A motion on 32 through
Yep,
35.
I would move 32, lines 32 through 35 into the budget.
Second on that. Representative Zager seconds. All those in favor?
All right. Next we have, line, I think we can do 36, 42 together.
Okay.
This is Office of Main Care Services. Line 36 through 38 is a reallocation of a social service program manager position from 76% general fund, 24% federal block to 50% general fund, 50% federal expenditures fund. Lines 39 through 42 is the transfer and reallocation of a social service program specialist 2 position from 72% general fund, 28% other special revenue to 50% general fund and 50% federal expenditures fund.
Motion on lines 36 through 42. Representative Daigle.
I move that we lines 36 through 42 go into the budget.
Second.
I'll second.
Second, Representative DeBrito. All those in favor?
With line 43, this is provides funding to achieve parity with cost of living adjustments for certain community behavioral health related services.
Motion on line 43.
I would move 43 into the budget.
Second by Representative DeBrito. All those in favor?
At the top of page 4. So this is line 44. This provides funding to establish a youth psychiatric residential treatment facility or PRTF in Maine. And that would provide $3,399,680 for that purpose.
Motion on line 44.
Maybe we
Or
won't do
Senator
it.
Moore.
No,
Oh.
you should go on.
Sorry. I would make the motion to move line 44 into the budget.
I would second that.
All those in favor?
Unanimous?
Unanimous.
Lines 44, 45, sorry, and 46 provide funding for a range change of 9 CPS program administrator positions from range 28 to 30. And that would be 79% general fund, 21% other special revenue.
Motion on lines 45 and 46.
Yep, I would move 45 and 46 in.
Second. Representative Shiguri seconds. All those in favor?
Make a comment on this.
Okay, go ahead.
I would just like to make a comment on this. I feel very bad for these employees that started in 2015 trying to be upgraded. And all, through 2018, I mean, just this length of time, it's, to me, I struggle. I feel really bad for them, that they have to wait that long to even be upgraded, just to be heard.
Okay.
We have lines 47 through 51, which would establish 2 management analyst 2 positions, funded 72% general fund, 28% other special revenue funds in OCFS, central office. And yep, that's that. So that's 47 through 51.
Okay. It also, it also does something else besides the management positions. Oh, yeah, I got it. A motion on lines 47 through 51.
This is the trust. This is the one about putting. It's the trust fund. Money into.
Yeah, because it's more, it's $1.5 million.
Oh,
Can you go ahead and,
yes. I probably should read the,
Yeah.
maybe the initiative justification.
Okay,
that
go ahead.
provides a little more context there. So this initiative establishes 2 management analyst 2 positions and provides funding to offset the use of federal benefits to pay for or reimburse the department for any cost of a child's care, and would require department to establish a special needs trust to use and conserve this child's benefit. The positions would provide report creation and dissemination for annual accounting to the child's attorney, or their guardian. This initiative would also provide funding for necessary training to children receiving federal benefits, department staff, and representative payees who receive the federal benefits on behalf of the child.
Okay.
Oh, and it's question 28, related to question 28 on your department memo.
Okay.
And the question there was, how much of the funding requested for the special trust is going to fund the management analyst as compared to what will go into the accounts? And the department's answer was the cost of the 2 management analyst 2 positions is $210,656 across accounts in state fiscal year 27. The funding to offset benefits is $2,808,128, all funds, with $1.48 million of that state general funds in state fiscal year 27.
As well, I'm sorry.
Okay. The amount that will be placed into each child's account will depend on individual benefits, but the 2.8 million is the total estimated need. There are additional costs associated with this initiative, including a contract with a fiscal agent for management of the accounts, which is the standard practice in states that use this model, of just over 890,000, and additional legal, technical, and training costs. And the prior question, question 27, just describes what those special need trusts are.
Okay.
All right. So that, again, this is lines 47 through 51.
Okay, so I would move lines 47 through 51 into the budget.
I'll second.
Second, Representative Brito. All those in favor? Opposed?
And that would just be out. Okay.
I would like to add a comment.
I would like to add the comment. I just have struggled when we have over 400 vacancies that we cannot find 2 employees that could oversee this without us having to hire 2 additional people, and the cost of what that is. So that's why I struggle. I cannot approve that going into the budget. Thank you.
And is it, just to be clear, so I've got your report, is it out for the whole of the initiative? I didn't know if you wanted to make a distinction between the money for the accounts and the funding for the positions.
I haven't talked to my caucus about this. I'm not sure. Okay, you want to do it that way? Okay, so we'll do it that way.
I'm sorry, what way?
I believe in, let me just, correct me if I'm stating this incorrectly. So they are voting in the money that would actually go into the special needs trust, but not the positions to support the
Even including the fiscal agent that needs,
the 890,000 for the fiscal
Right.
agent.
that's,
Yeah. Yes.
eh,
So that would be out.
out.
All right, we've got line 52. And this would provide funding to increase lifespan waiver slots during and beyond the implementation of the HCBS, that new HCBS waiver program. And that also is addressed in the memo. Sure, probably somebody can find it faster than I can. Number 20. Yes, yes. Okay. So the question was, what is the department's plan for implementing the recently completed rate determination for the lifespan waiver? Is there additional funding to meet those new rates? The answer the department provided, the department is aiming for CMS approval of its lifespan waiver application by October 26. Although the actual approval date is dependent on CMS and implementation is contingent on numerous systems and process changes that the department is working to have in place. The department has requested and received other appropriations related to implementation of the lifespan waiver in the past and has not sought additional funding. There was also question 21, which was to provide information on the additional services for lifespan that are not currently provided as part of sections 21 and 29. The answer, the lifespan waiver effectively combines two legacy waiver programs, sections 21 and 29, into a single flexible waiver serving individuals beginning at age 14 and continuing throughout the lifespan. It is designed to offer a broader, more individualized range of service options to support people to live in their own home or apartment, pursue employment, and participate in their communities. Lifespan proposes new services not currently available under sections 21 or 29, such as community supported living, community transportation, co-worker supports, and peer support, and expands opportunities for self-direction, including allowing additional service types. For example, select employment services to be self-directed. Additionally, once enrolled in lifespan, individuals would not need to transition to a different waiver as they age or if their needs increase. The Office of Aging and Disability Services has published a 2026 information sheet with additional detail. It is available on the Lifespan Project homepage along with other helpful, easy to read resources, and they did provide a link for you to review that. Importantly, individuals currently enrolled in sections 21 and 29 may remain in their current waiver if they choose or transition to lifespan when eligible. So this is lines 52 and 53.
Do I have a motion on lines? Oh, you have a question? Go ahead.
Thank you, Senator. So the lifespan waiver has not been approved yet, correct? So you're not using it. Right. So what's the $4 million paying for? If there's no services being provided, what are we paying for?
Thank you, Representative. I'm Molly Bogart from the department, and the request is for fiscal year 27, which is when we would begin enrolling people. So this is in order to pay for those slots once we are enrolling folks.
Okay, but if it's not approved by October, where's this money go?
I mean, if it is not approved by CMS and we don't start enrolling people, then I imagine you'd see an initiative related to that in the next budget.
Okay,
That is certainly not our intention.
Right, obviously. But this is for 27 if we're approved to start the process going and start paying for services. Thank you, Molly.
Yeah.
Thank you, Molly. We have a motion on line 52 and 53. Yes, Representative Graham.
I make a motion to move lines 52 and 53 into the budget.
Representative Jagory, seconds. All those in favor?
Unanimous. Right. Lines 54 and 55 provide funding to replenish 15 reserve slots for individuals who have been determined priority 1 waiver program candidates for section 21.
Okay.
And I can read maybe I'll read the justification a little for that. The ODES funds and maintains reserve section 21 waiver slots for individuals in urgent need of services. Individuals with an urgent need are classified as priority 1, the highest level of priority. This classification is for individuals in need of adult protective services or who are at risk of abuse, neglect, or exploitation, often due to the fact that their primary caregiver has reached the age of 65 or older, or has a terminal illness and can no longer meet the needs of the individual. Program attrition is the means through which the reserve slots are normally opened or maintained, but the section 21 waiver program is currently on the verge of running out of reserve slots. This means that individuals at risk of being abused, neglected, or exploited would need to wait for someone to leave the waiver before they are eligible to receive services. And then these 15 reserve slots would be available solely for the purpose of giving the opportunity for an individual determined to be the closest in proximity to abuse, neglect, or exploitation, an opportunity to plan for medically necessary services, to meet their health and welfare, and provide support to live their life in the most integrated setting of their choice with the services and supports most appropriate to meet their needs. Without replenishing these slots, means most vulnerable would likely have no other option but to remain in situations and environments placing them at great risk for their health and safety, or at risk of acute care, institutional care, or find themselves within Maine's correctional facilities.
52.
No, it's 54 and 55.
54 and 5.
Any questions around this or comments? Yes, Representative.
Yes, I would move 50.
Michelle Way says.
Go
You
ahead.
okay?
Oh, I was going to make a
He's making a
motion.
motion. Okay.
I'll let you make the motion. Go for it.
Thank you, Madam Chair. Let's see, I make a motion for line items 54 and 55 to be moved into the budget.
Okay.
And I'll second
A
that.
second.
Thank you.
All those in favor?
Unanimous. 56 and 57, this is for developmental services. This adjusts funding to align allocations with projected expenditures and available resources.
Okay.
I'll make the motion, move lines 56 and 57 into the budget.
Second by Representative Daigle. All those in favor?
Representative Griffin.
Oh,
Thank you, Abby.
Okay, so line 58 is the state supplement to federal supplemental security income. And this moves $1 million of the unencumbered balance forward to DHHS state supplement to federal supplemental security income program general fund account, all other line category lapsing to the unappropriated surplus of the general fund no later than June 30th, 27. And that's also language part CCC, which says the same thing, just in language form. So we can vote those at the same time. So this would be for part CCC and also for line 58.
okay. The lines, motion on lines 58 and line 189, it looks like. Yes, Representative Brito.
Thank you, Mr. Chair. All right, so I make a motion to move line 58 and line 189 into the budget.
A second. Let's have a second. Second, Representative Zager. All those in favor?
Sense, makes no sense to me.
Go to clarification.
Unanimous, okay.
You can ask for it.
I'll make a comment.
Okay.
I just have to make a comment. I understand, that we are transferring the funds, the unencumbered funds and so forth. I guess I just don't understand if we have these unencumbered, why we are not using this 1 million, and then we've got 3.6 million in line 59 for these other services that we do really need and funding those instead. I just don't understand why we are giving it back, so to speak. So that's where I'm confused.
We have someone from the department like to come help answer that question. You can ask that before we vote.
I know it. I didn't get a chance.
That's okay.
Thank you. So specifically on line 58, these funds are being returned. It's not anticipated that the unencumbered balance forward for this program will be needed in this biennial. So those funds are being returned to the state general fund. And as on line 59, again, those are balances yet to be identified that the department anticipates not needing for the programs for which they were appropriated. So those balances sit in the unencumbered balance forward. So they're being returned to the state general fund in order to provide savings within the budget.
Thank you. So in other words, they are going to be used for something else.
They're going to go back to the state budget to be reappropriated as deemed by the legislature.
Okay, so could be some of the programs that we have that we're trying to fund even within this budget.
It is essentially serving as a offset to budget requests within the greater budget. So it's being returned to the state general fund to be then reappropriated.
Can be used in this budget?
To be used in this budget?
Not currently, this.
If you appropriate it, yes.
Oh, all right.
Or it would be for a future
right.
year because the funds would be lapsing at the end of the fiscal year.
Representative Fredericks.
Thank you, Mr. Chair. And just a follow-up question, kind of linked to my initial question. So if you took no action on this, would these funds be returned to the general fund at the end of the fiscal year?
In this case, they would not be because they're in carrying accounts. So if these items were not in the budget, then they would not be returned to the state general fund because they are in a carrying account. And there's a list of carrying accounts at the end of the memo.
I see.
So those accounts have special carrying provisions and most of them are main care related, but there are other accounts within DHHS that have carrying provisions. So those funds would continue to sit in the unencumbered balance forward until either appropriated by financial order or lapsed in this manner back to the state general fund.
Follow-up question, Mr. Chair, if I may. So in addressing carrying accounts, are those funds discretionary? Is that what you're saying? That they could be returned or they could be used for other things? The carrying accounts?
So the balances, again, the balances will continue to sit in that unencumbered balance forward until either appropriated for that specific, for the purpose which they were appropriated for, or they would be purposely lapsed.
I just want to say the same thing you're saying in a different way.
Okay.
That's very nice.
Translate.
So I think Senator Moore, we're doing exactly what you're talking about. We don't have the authority to say we've got $500,000 that was appropriated but unused in general assistance. So now we're going to go and use it in child welfare. Those are exactly why we have these initiatives, right? We've got those balances. So we're saying, legislature, we don't need it for X account, but we do need it for these initiatives. And so we don't have the authority to use that discretionarily, except within the programs that it's appropriated for. So I think given to, the initiatives are essentially what you're talking about, which is if we're giving it back, why aren't we using it for this?
Correct.
That's basically what we're doing. It's just we have to do that accounting and we have to do it in a sort of transparent and approved way by the purse strings.
I just don't want to go into any other departments there.
We're frequently told by our colleagues that we are often the biggest askers. So as you can see, we are asking for much more than we're returning to the general fund this year. I appreciate that.
Thank you, Molly.
And Representative Fredericks has a question.
No comment. And I want to thank you, Molly, for that explanation. It was very helpful. There's been a notion that some funds are used as a slush fund. And that's what I wanted to either, we needed to address that. And thank you
Appreciate
very
it.
much.
Yeah.
Okay. Yes, Representative Daigle.
So essentially, you're waiting for authorization from above to determine where those funds will be allocated. Okay.
Does that mean you're above? Is that what you're saying?
I'd say adjacent. Co-equal.
Okay, Representative Daigle.
Thank
All right. Which lines are we considering?
We are now on 59.
Line 59. Do I have a motion on line 59?
We did 58 already.
All right, we did
That was
59.
unanimous.
So line 59 is also
Oh, we did it. Okay, sorry.
we did
58.
58.
We voted on 58. We
We're on
all
Yes.
set.
59.
Okay.
So we're doing
sorry about that.
59.
Yeah, we're unanimous.
Which is the 3.6 million unencumbered balance, lapsing back to the general fund.
Okay. A motion on
And also
59.
DDD. That's
Oh,
the
yeah,
accompanying language. That's line 190.
190.
190. Okay, so we're making a motion on line 59 and 190.
Okay, so I would move line 59 and 190 into the budget.
And do we have a second by Representative Brito? All those in favor?
Next, we've got 60 and 61, which reallocates the cost of one social service program manager, one position from 100% general fund to 60% general fund and 40% other special revenue.
Line, it's only line 60, or is it?
Line 60 and 61.
Motion on line 60, 61. Representative Zager,
Thank you, Mr. Chair. I move lines 60 and 61 into the budget.
second. Representative Brito seconds. All those in favor?
Did I think Representative Daigle? Okay, unanimous. All right. Line 62 through 65 reduces funding for the approved reorg of one public service manager 3 position to a public service coordinator 1 position and transfers and reallocates the cost of the position from 60% general fund and 40% other special revenue funds to 50% general fund and 50% federal expenditures fund within OMS.
Okay. Motion on line 62 through 65. Representative Zager,
Mr. Chair, I move lines 62 through 65 into the budget.
and a second. Second by Representative Shiguri. All those in favor?
Line 66 provides funding for a cost of living increase for state-funded HCBS services related to Chapter 5, Sections 61, 63, 68, and 69, and those are ODES services.
Motion on line 66. Representative Meyer.
I motion to move line 66 into the budget.
And I would second that.
In second. Don't fight now.
Throwing
All
your
those in
voice out
favor?
there.
Unanimous. Line 67 is for the Developmental Services Oversight and Advisory Board. This provides funding for the main Developmental Services Oversight and Advisory Board to meet its statutory requirements, and that's $58,715.
Okay,
67, I would move line 67 in.
Second.
all those in favor?
Okay, it's unanimous. Line 68 is for Disability Rights Maine. It provides funding of $20,000 for increased costs for inflation, rental and lease agreements, supplies, sign language interpreters, professional insurance, travel health insurance, and cost of living wage increases. It's $20,000 in each year.
I would move line 68 in.
Second by Representative Brito. All those in favor?
And that's unanimous. Line 69 and 70 provides funding for increased main care disability determination services. These are 50% general fund, 50% federal expenditures fund. And I think I'll read the initiative justification for that one.
Yeah.
Thank you.
So HR one introduces new work requirement and verification provisions that will substantially increase the volume of medical exemption requests submitted by clients seeking to demonstrate they are unable to work due to physical or mental health limitations. These requests must be reviewed and verified by the medical review team in accordance with federal and state policy. With the enactment of HR one, the state is legally required to implement new work and community engagement requirements for Medicaid enrollees aged 19 to 64 and must verify compliance or exemption status, including medical exemptions under the statutory framework. Because the law mandates ex parte verification where possible, but also requires notification and opportunity for individuals to supply documentation when automatic verification is insufficient, the volume and complexity of medical examination reviews will increase significantly. Without additional funding to expand the medical review team's capacity, both for clinical reviewers and supporting staff, to upgrade automated verification systems and to ensure timely processing and due process, there's a high risk of delays, improper denials, non-compliance with federal statute, and adverse outcomes at risk for vulnerable individuals.
Motion on line 69.
And 70.
Oh, and 70.
I would move lines 69 and 70 in.
Second? Second by Representative DeBrito. All those in favor?
Okay.
And opposed?
Okay.
There's no NTP.
No. Just no entry into the budget, please.
Okay. So 7.5. Okay. Line 71, Office of Main Care Services, line 71 and 72 rather, is a reclass of one reimbursement specialist position to a management analyst, one position, 50% general fund, 50% federal expenditures fund. And this will include a one-time retroactive payment.
I'll make the motion to move lines 71 and 72 into the budget.
And a second on that? Second by Representative Lemelin. All those in favor?
That's unanimous. Line 73 and 4 provides funding for contracted actuarial services, 50% general fund, 50% federal funds. And this is related to the forecasting and fiscal management required pursuant to HR 1.
Okay. I'll entertain a motion for 73 and 74.
Yeah, I would move 73 and 74 into the budget.
A second, Representative DeBrito, or was that Representative Graham? I'm sorry. All those in favor?
Came from that end of the thing.
All those in favor?
7. Okay. All right, 7.5. Right.
And just not putting it into the budget.
Okay. All right, we're on page 7. This is line 75 and 76 establishes 2 public service coordinator, 1 position and 1 management analyst, 2 position, 50% general fund, 50% federal fund, federal expenditures fund related to implementation of the requirements of HR 1.
Okay. A motion on 75 and 76.
I would move 75 and 76 into the budget.
Oh, do you want to speak?
Yeah, I can save you time. We can go 75 right through 84 together if you want to.
All in favor? Oh. All right.
No,
Well, let's
that's okay. We can do them the way we were going to do them.
let's do them separately.
Yep. So 75 and 76 into the budget is the motion, and there's a second.
One second.
All in favor?
7.
And opposed?
5. Okay.
All right.
Line 77 and 78 establish 1 limited period comprehensive health planner 2 position, 50% general fund, 50% federal expenditures fund. And that's to assist with rulemaking and state plan work for compliance with HR 1.
A motion on 77, 78.
Line 77 and 78 into budget.
Representative Graham, second. Representative Brito, all those in favor?
Okay, and we're missing Representative
And
Sager.
opposed.
Okay. So we'll get Representative Sager's vote on that. Line 79 and 80, establish one provider relations position and two eligibility specialist, two positions, 50% general fund, 50% federal, again, to support implementation of the requirements of HR 1.
Motion for 79 and 80.
I would move 79 and 80 into the budget.
Second. Representative Brito, seconds. All those in favor? Okay. 6. And opposed.
Okay. Just need Representative Sager's vote on that one. 81 and 82 provides funding for staff augmentation. Again, 50% federal fund, 50% federal, 50% general, 50% federal. Again, related to the requirements of HR 1.
Okay, 81 and 82. Motion. Representative Brito.
Thank you, Mr. Speaker. Mr. Speaker.
Okay.
Line 81 and 82 into the budget.
And a second. in that. Representative Shigori, seconds. All those in favor?
Alright.
And opposed.
And again, we'll get Representative Sager. Lines 83 and 84, establish one comprehensive health planner, two position, 50% general fund, 50% federal. And this is related to program integrity work, which will is again required for work related to HR 1.
Okay, 83 and 84. Have a motion
I would move 83 and 84 in.
in a second. Representative Shigori. All those in favor?
Calling on people, right?
6. And opposed.
Right. And again, we'll get Representative Sager. All right, line 85, adjusts funding to align allocations with projected expenditures and available resources.
I'll make a motion to move line 85 into the budget.
Second on that. Second by Representative Shigori. All those in favor?
That's unanimous among those present. We're on page 8. So lines 86 through 88 provide one-time funding for technological adjustments in compliance with HR 1. And this is to provide funding for an outreach campaign related to eligibility changes, system enhancement to MIMS, to allow pharmacists to enroll as providers and to eliminate coverage for certain non-citizen groups, and the development of a tool to determine work requirement exclusions to adjust requirements related to HR 1. And this is also related to language part T. And this is,
Because of the
Yep.
rainy day funds.
yep,
That's line 183. So,
so this would be lines 86, 87, 88, and 183.
okay, 86 through 88 and line 183. We have a motion.
I make a motion to move in 86, 87, 88, and line 183 into the budget.
And Brito seconds. All those in favor? And opposed?
Okay. Thank you. All right, lines 89 through 92. This establishes 35 eligibility specialist 1 positions, 4 family independence unit supervisor positions, and 1 program administrator. within the Office for Family Independence, and establishes 1 management analyst 2 position, 1 senior planner, 3 eligibility specialist 2 positions, and 1 business administrator position within OFI. That is funded 25% general fund, 75% other special revenue funds to implement main care work requirements required by HR 1.
Do you mind reading the initiative?
Absolutely.
Justification?
I sure will.
Thank you.
OFI is planning to implement 3 interrelated main care requirements as a single initiative due to their shared timelines, costs, and impacts. Community engagement work requirements impacting nearly 100,000 members. Changes to renewal periods, which changes the renewal requirement from annual renewal to 6-month renewal, and changes to retroactive eligibility. These changes are the most significant changes to the main care program since the Affordable Care Act and are expected to bring significant processing and technology challenges that must be overcome in order to minimize disenrollments of main care members, which will have ripple effects throughout the healthcare system. Approximately 34,000 members could be disenrolled from the program, and 28,500 cases could result in manual work verifications and increased manual renewals. Existing staff are not able to meet this increased demand, nor to implement new technology requirements that must be in place by fall 26 to allow staff training and ensure January 27 renewals follow the new process. Staffing to manage work requirements should be in place by April 1, 26, with additional processing staff effective July 1, 26. The initiative staffing needs include 1 business systems administrator and 3 user acceptance testers for technology, 1 management analyst 2, and 1 senior planner program manager for policy, and 1 program administrator, 3 FI supervisors, and 3 eligibility specialists, 1 for operations.
So, Mr. Chair, maybe we could have the department come up and just shed a little light on exactly why we find ourselves in this unfortunate position. Yeah. Thank you, Director.
Good afternoon. My name is Ian Yaffe, and I'm Director of the Office for Family Independence within the Department of Health and Human Services.
So just a little bit more clarity around what's happened at the federal level that would require this initiative, these positions.
Great. Thank you. So these positions specifically are related to the new requirements for community engagement requirements, retroactive coverage changes, and increased frequency of renewals for main care members, all of which impact the main care expansion adult population. And so for us, we need these positions to essentially deal with all of the increased work that we're going to have related to main care as a result of these changes, and specifically thinking that we will have double the frequency of renewals. So we'll have double the work to do. Many of those renewals are automated, but we also expect that percentage to decrease once the work requirements and community engagement requirements come into effect, meaning that we'll have an increased volume of manual renewals that require a staff member to process, as well as increased verifications that those staff members may need to do, because they'll not only need to verify the existing things that we have to look at for the financial and non-financial requirements for a main care renewal, they'll also need to now verify whether somebody has met the community engagement requirements. And that could be through employment, that could be through volunteering, or it could be through some sort of exemption.
Right. So on top of the work that's presently being done by the existing staff, there are more frequent eligibility requirements, and then all of the verification that goes around the work requirements.
Right. And so we aren't able to do all of that additional work with our
With your
existing
existing staff.
with our existing staff. And these are permanent changes to the main care program. So there's no these aren't going to be time limited,
Right.
a time limited increase in work that we're going to have to do. We expect it to be a permanent increase to the work that we have to do. The only other piece of information that I thought might be helpful is just keeping in mind right now that our staffing level for eligibility specialists per main care member today is right around 1,000. So we have one eligibility specialist, generally speaking, for every 1,000 main care members. That number 10 years ago was one eligibility specialist for every 780 members. So we have done a lot over the past several years in increasing the efficiency of our staff. And at this point, we don't feel that we can gain more on the efficiency side. We need more people to do this increased volume of work, which we referenced in the justification could include something like 28,500 cases that would now need to be manually processed twice a year instead of being automatically processed. So when you start doing the math on what we would expect a staff member to do, how many cases they could process in a day, how many transactions they could do, that's how we came up with the number of 35 positions would be necessary for the community engagement requirements, verification, renewal period changes, and the changes to retroactive coverage. And these will be separate from the conversation that we'll have about the changes related to SNAP. These are exclusively focused on the main care related changes.
Does this also relate the need for this increased attention, not just relate to the payment, keeping the payment error rate manageable as well?
These specific positions are just related to main care community engagement requirements.
Okay.
So we have a separate number of positions related to SNAP that is primarily focused on reducing the payment error rate.
Okay. Yes, Representative Sager.
Thanks, Mr. Chair. Director Yapi, how readily will the department be able to hire these folks? When we authorize the positions, that doesn't mean that the person sitting in the seat, like, is there going to be a lag or difficulty filling the positions? Do you anticipate?
Thank you for the question. That depends a little bit on what the effective date of the budget is, but right now we are anticipating that we would hire these anticipated vacancies as soon as the budget is finalized in the summer. So we would expect that we have people in seats between July and August of this year, and that they would then go through their training and essentially be ready to start processing main care related applications, renewals, and other tasks by December, which is when we would need them to be fully operational, because we would expect our increased volume of work to begin in the month of December.
So kind of just in time, in other words.
With essentially no months to spare.
Yeah.
So,
Okay. Thank you.
thank you.
Representative Daigle.
Just a comment. We're asking a lot of workers, small businesses to fund this increase where they're facing the same thing, where they have to do with less. And you look at what we're going to pay each one of these people, a lot of these people will actually earn less than this amount yearly. So it's really hard for me to go home and to my constituents and say, no, we're going to give all this money here. And they say, well, what about us? So that's when I look at these types of funding issues and work issues, I talk to people who are having to work a whole lot more to make it their ends meet. And we're going to take more from them. So I have a real concern about this.
Representative Graham.
Thank you. My question is, if we don't meet these deadlines, what happens? Excuse me. It's not appropriate.
So all set. Yep. Thank you. Thank you for the question. So essentially, if we aren't able to get these positions We will have implemented these requirements, the new community engagement requirements, without people to process them. And what would happen is that we would have an increase to the backlog of main care applications and renewals that aren't processed timely. We already need the full 45 days, in some cases more, to process main care applications. And that length of time would grow, at which point, if we aren't able to make an eligibility decision, we would be required to use state funds to cover that individual until we make the eligibility decision. So there, that would be what happens on the application side. On the renewal side, we would be not able to make decisions. So people who would have been eligible may close because their renewal wasn't processed, or people who are not eligible won't have that timely decision telling them that they don't meet the requirements. And the same thing will happen with the regular transactions that we get, like changes of address. We just won't be able to process those things timely, causing a snowball effect that doesn't just impact the 100,000 main care members under community engagement requirements. It would impact all of the other main care members whose work would be behind the lines of people based on the date that we receive it. So essentially, that's the risk here that we're trying to avoid, is a risk of us unable to process work in a way that causes a significant delay to application processing timelines, renewal processing times. And that would cause not only compliance concerns with the federal government, it would cause concerns for all of your constituents who wouldn't be able to get timely decisions from us. Again, whether they're eligible or not eligible for the program, we wouldn't be able to make those decisions timely.
Customer service.
And would the federal government withhold monies if we don't meet those deadlines?
I'd have to look at the specific penalty procedures, but that 45-day timeline is a federal standard. So we would be in non-compliance with those standards. And then we would have to face whatever the consequences are. And at times when it's clear that those are going to become systemic issues, the risks of financial penalties would grow.
Yeah.
Representative Fredericks.
Thank you, Mr. Chair. Thank you, Director Yaffe. Of your current funded 112 vacant positions, could you hire into those positions now to assist with the community engagement processing needs?
Great. Thank you for that question. I just wanted to pull up one piece of information. So right now, OFI has, I think, just over 100 vacancies that you noted. Of those, 26 vacancies are at disability determination services, and those are those are all federally funded, but they're currently unable to be hired on due to a hiring freeze at SSA, and so we can't use those positions here. They have no general fund attached to them, and they're not in the main care program. We also have 46 vacant positions at the Division for Support Enforcement and Recovery, or DESER, and those positions are currently being used for a reorganization of our human services enforcement agent positions. Those positions can't be used here again because they're in the wrong office, and they're funded by child support, so they're not positions we can use for this purpose. That leaves us with approximately 24 current eligibility specialist vacancies, nearly all of which we posted last week. Those vacancies typically for us occur on a quarterly basis. We tend to accumulate vacancies out of our roughly 400 eligibility specialist positions, and then we bring them on quarterly in line with our training schedule. Those vacancies are essentially going to be hired on in the coming months. So they will help us here, but they're part of our existing baseline and our existing staffing that we need to meet the existing program needs, not the new program requirements that we have related to community engagement requirements.
Any further questions?
Just, so if not but for HR1, you wouldn't be asking us for these positions. The need would not be there for these positions. Is that correct?
Correct.
So when my constituents ask me why these positions are necessary and the general fund dollars associated with these positions are necessary, I point them in the direction of the federal government. Thank you.
Representative Wellen.
Thank you, Senator. The reason we're voting no on all these initiatives is because we look at this in a little different light. I respect and understand your viewpoint, but our viewpoint is different. We look at it as HR1 is a good thing, because for the last 6 years that I've been on this committee, a lot of the things within HR1 are what we've been asking the department to do for the whole time I've been on this committee. So in our opinion, Maine Care should already be doing everything in HR1. We don't feel that we should be in a panic mode. We feel that the department should be prepared for this and be able to handle the changes. In my business, when CMS made drastic changes, I didn't go hire 4 new people for my clinic. We just went to our staff, trained them, and said, this is the way you got to do it. And whether it was extra work or not, they got it done. I also didn't go spend millions of dollars changing my computer system like you want to spend here. We called the provider and said, look, here's the federal changes. What can you do to help us? And they made the changes. So we're not quite understanding why we need $5 million for all new software. We think that you should just call the people that gave you the software in the first place and say, hey, we need these changes, and let them make the changes, and that would be a lot more cost effective. So I just want the people of Maine to understand that we see this differently. HR1, in our opinion, is a very good thing, and we should have been doing it all along. So it's just a different outlook. And that's why we're voting no. We're positive that you can get the job done without the positions, and that the computer software can be updated for a lot less money. So that's where our position is. Thank you.
Okey doke.
All right.
Moving on.
Yes. Do we have a motion? On, I believe it's 89 through 92.
Okay, I would move 89 through 92 into the budget.
Second, Representative McKay. All those in favor, excuse me. Thank you.
Yes, thank you.
Director Jaffe. Thank you.
7.
And opposed.
5. Okay. Red line 93 through 96. This adjusts funding for positions at Dorothea Dix as a result of the decrease in the 2027 FMAP. The new blended FMAP is 60.7875%, which is a change from 61.29% in fiscal year 25-26.
It's 93 to 96.
Yes.
I would move 93 to 96 in.
And we have a second. I'll second. Representative Shiguri seconds. All those in favor?
That's unanimous. Similarly, lines 97 through 100 adjusts funding for positions at Riverview due to the change in FMAP.
97 to 100.
97 to 100. Do I have a motion?
I'd move them in.
And second. I think that was Representative Graham. All those in favor?
And that's unanimous.
Unanimous.
Okay, line 101 would provide funding to reduce the FMAP for emergency service for non-qualified immigrants who would other qualify for Medicaid expansion from 90% to the base FMAP pursuant to HR 1.
Okay. A motion. Motion Representative Brito, motion
I'll make a motion to move line 101 into the budget.
and a second. Representative Sager seconds. All those in favor? And opposed.
Okay. Lines 102 all the way down through line 118 adjust funding as a result of the increase in the state share of blended FMAP.
Okay.
I'd move 102 to 118 into the budget.
And a second on that. Representative, excuse me. Daigle. All those in favor?
And that's unanimous.
Getting a little punchy here.
Take a break.
Now, lines 119 through 120.
Take a break for 5 minutes?
All those?
Yeah.
Just me?
No, all of us.
Yeah, let's do it after this line.
Okay.
Okay. So lines 119 through 120 adjust funding for payments to providers between the general fund and other special revenue related to hospital rebasing. And there was questions about how rebasing worked, and that is in your MO. No, I saw it here. Is 11 and 12. I can read those if you want. Yeah, please.
Yeah.
So number 11, how is the rebasing initiative similar and different to how we've seen in the past? The hospital tax has been rebased several times historically. This rebasing ensures hospitals are being taxed on the most recent year of revenues earned. In several instances in the past, when the hospital tax was rebased, the supplemental pool payments paid to hospitals also increased, offsetting the tax increase. However, recent federal scrutiny on provider taxes has made clear that states should not be holding providers harmless for tax obligations, including making an offsetting supplemental payment. As a result, the department has instead proposed using the increased revenue to cover cost growth associated with hospitals, including Medicare-related expenses to account for changes in the market basket index, interim cost settlement increases, and increases in the hospital prospective interim payment obligations. Number 12, did the federal government prohibit provider taxes, and how can we do rebasing? Public Law 11921 HR 1 included two provisions regarding provider taxes. One section 7117 closes a loophole CMS claims states use to construct taxes in a way that avoids uniformity provider tax requirements. CMS has issued a final rule essentially formalizing this section into rule. This rule does not impact Maine or its ability to rebase taxes. Another section, section 7115, effectively bans new provider taxes by setting the indirect hold harmless threshold equivalent to the percent of net patient revenue for healthcare related taxes enacted and imposed as of July 4, 25. While there is significant uncertainty with how CMS will implement this provision, the department believes that even with rebasing its hospital tax, it will still be within the set percent of net patient revenue of the hospital provider class. It is important to note that these changes are effective October 1, 26 due to uncertainty over how CMS will implement the provider tax moratorium under Public Law 11921. The May 26 tax payment may be the last opportunity to increase revenue from the hospital tax to reinvest in state services with federal match. And I'm sure if you want further explanations, somebody can help with that.
Anyone need to hear more?
Came from a motion?
And this is also language part L, I'm sorry,
That's all
which
right.
is line 182.
Okay. Okay, I'll entertain a motion on 119, 120, and 182.
Okay, I would move 119, 120, 182 in.
Second, all those in favor?
And that's unanimous.
And we're making good progress. Well, let's take a break. 5 minutes.
Yep.
Thank you. Go ahead, Sam. Yep, jump right
Do
in,
it.
Sam.
All right. So we're gonna get started again. We're at the top of page 10 on the green sheet, lines 121 and 122. This provides additional funding to cover increased hospital costs. This is a companion initiative to the hospital tax rebasing and reinvest the additional general fund revenue to cover increased hospital costs. These costs include Medicare-related increases to account for changes in the market basket index and interim cost settlement increases and increases in the hospital perspective interim payment obligations associated with hospital cost growth.
Do I have a motion? 121, 122,
I would move 121 and 122 into the budget.
and a second. Second by Representative Shiguri. All those in favor?
Present. Line 123 adjusts funding in the Office of Main Care Services Federal Expenditures Fund between all other and personal services to correct the allocation of funding approved in Public Law 25, Chapter 388, which established positions for HCBS, for the HCBS lifespan waiver. I'm sorry.
Line 123.
Yeah, I would move 123 in.
I'll second. All those in favor?
Unanimous among present. Next is line 124 all the way through line 138, which provides funding to increase main care appropriations and allocations to reflect trends in healthcare costs and enrollment. This initiative requests funding to better align appropriation and allocation levels to the currently projected amounts and includes updates for general cost increases in residential and home and community-based services, hospital cost settlement, hospital prospective interim payments, and federally required coverage of new and expensive drugs, among other areas.
Here are a motion through 124 through 138.
Yeah, I would move 124 through 138 in.
And a second.
I'll second.
Second by Representative Shiguri. All those in favor?
Okay.
And opposed?
Okay. Line 139 and 40 provide funding for the annual Medicare Part D rate increases.
Okay. I hear a motion.
I'll make that motion to move line, I lost my spot,
139.
139 and 140 into the budget.
A second by Representative Lemelin. All those in favor?
Unanimous among those present. Lines 141 through 143 provides one-time funding for a 2.5% temporary rate increase to the Medicare physician fee schedule pursuant to HR 1.
Okay. A motion on lines 141 through 143.
I would move 141 to 143 in.
All those, or a second. Representative Grant seconds. All those in favor? And opposed?
Line 144 provides one-time funding to offset the provider impact of the federal budget reconciliation law, Public Law 11921, Section 7113, which prohibits federal match for payments to prohibited entities as defined in Section 7113 for a one-year period beginning July 4, 25.
I'll hear a motion on line 144. Representative Zager
Thanks, Mr. Chair. I move 144 into the budget.
and Representative Graham seconds. All those in favor? And opposed?
Line 145 provides, and 146 provides additional funding to increase supplemental payments to private psychiatric hospitals. And this is aligned with language part AAA. And that would be line 187.
So it's 145 and 146, Sam?
Yes, so it would be 145, 146, and 187.
Okay. A
I would-
motion on line
Yep, I would
145.
move 145, 146, and 185, 7 into
187.
the budget.
A second?
I'll second.
Second by Representative Shigori. All those in favor?
Oh, sorry.
Unanimous. Mr. President.
Lines 147 through 149 provides funding to reflect meaningful cost differences faced by the Maine's Veterans Home nursing facilities in per diem rates for services provided to Maine Care members. I'll read the initiative for that, the justification. Maine Veterans Home nursing facilities face cost challenges that may not be fully met under existing payment structures. This funding would allow the Maine Care program to reimburse Maine Veterans facilities for covered nursing facility services on a per resident daily rate basis that is reasonable and adequate to cover the total Maine Care allowable costs of operating veterans facilities in alignment with a broader reformed reimbursement structure for all nursing facilities.
Yes, Representative Zager.
Thanks, Mr. Chair. A couple of years ago, the legislature was kind of ground to a halt because there were a couple of Maine veterans homes that were on the verge of closure, and we had to find the money. And the Maine veterans homes came to the joint hearing that we had, asking that instead of the larger one-time funding and then this $500,000 in line 147 as the ongoing, asked for the lion's share to be in the ongoing in the nursing facilities account. I had a discussion with the department and understand that there's a potential hazard of there's certain federal maximums that there's a potential hazard if we go over that, then we would need to, unless that would, if we want to get the federal drawdown, then we would have to claw back some money, which could be problematic, inefficient. But I still think that I would like that that we basically be a little bit more, increase the funding, be a little bit more proactive so that we don't have a repeat of what we had a couple of years ago. So we don't have closures. And so I was hoping to include or, submit to the committee to include in our report back on these items, some principles, and ask that the AFA work with the Maine veterans homes to figure out a way, and the department to figure out a way to, number one, make sure that we are covering healthcare for these veterans. Number two, that we minimize the risk of closures that we had to contend with a couple of years ago. Number three, leverage as much as we can without exceeding those limits at the federal government. So leverage as much as we can from the federal drawdown to accomplish the first two things. And number four, not create extra work for the department because they don't need extra work. So I would like to move these items 147, 149 into the budget and submit to the committee that we include in our report back those four principles and recommendations.
Good. A second by Representative Daigle on the motion. All those in favor?
Unanimous, my most present. So we will include that in some language that we have in our memo asking that AFA consider those things as they review their budget. Okay, line 150 to 152 provides one-time funding for a supplemental payment to the Maine's Veterans Home for main care residents. And this is, goes along with language part WW.
Okay. Yeah. So I'll take a motion on lines 150 to 152 and 184. Representative Zager.
Thanks, Mr. Chair. I move lines 150 to 152 plus line 184 into the budget.
A second on that? Representative Daigle seconds. All those in favor?
Representative Shigori.
Okay. Did we have all voting for?
Okay. All present. Great. Line 153, adjust funding to align allocations with projected expenditures and available resources for nursing
For
facilities.
nursing facilities. I would move 153 into the budget.
And I'll second the motion.
All those in favor of line 153?
All present. Lines 154 through 157 reallocates positions within OFI as a result of the decrease in the Supplemental Nutrition Assistance Program federal fiscal participation rate from 50% to 25% as of October 1, 2026 pursuant to HR 1.
Okay, all those in favor of lines?
We
or,
need to-
Excuse me, a motion,
First, yeah.
154 to 157.
I'll make a motion.
Okay, Representative Graham makes a motion. Do we have a second?
I'll second.
A second, Representative Shigori. All those in favor? And opposed?
Lines 158 through 163 adjust funding between the general fund and other special revenue funds in both the Office for Family Independence Program and Office for Family Independence District Program, and between general fund and federal expenditures fund in the Food Supplement Administration Program as a result of the decrease in the Supplemental Nutrition Assistance Program federal financial participation rate from 50 to 25% as of October 1, 2026 pursuant to HR 1.
A motion on lines 158 through 163. I'll make a motion that we lines 158 through 163. Have a second on that? Representative Zager seconds. All those in favor?
Okay.
And opposed? Yes.
All right. Lines 164 and 165 establishes 40 eligibility specialist 2 positions and 4 family independence unit supervisor positions within OFI. Funded 44.8% general fund and 55.2% other special revenue to improve the SNAP payment error rate pursuant to HR 1. I'm going to read the justification for this.
Yes, thank you.
Due to Public Law 11921, the Office for Family Independence must reduce its SNAP payment error rate to below 6% as quickly as possible, with the final opportunity to avoid federal cost sharing in federal fiscal year 26, October 1, 25 to September 30th, 26. Maine's federal fiscal year 24 payment error rate was 10.26%. As compared to the national average of 10.93%. And the current federal fiscal year payment error year-to-date rate is 9.58%. At current benefit issuance levels of $356 million annually, cost sharing beginning October 1, 27 federal fiscal year 28 would range from $0 if the payment error rate is under 6% to as much as 53.4 million if the payment error rate remains above 10%. Without significant investment and priority in mitigation efforts, Maine can expect to remain above 8%, which would result in a $35.6 million in cost sharing. Rapidly reducing the SNAP payment error rate to below 6% will require substantial technology investments that are not feasible through simple reprioritization, as well as hiring and training more eligibility specialists to be able to provide more timely agency actions and make it easier for clients to be able to report changes. Increasing Maine's eligibility specialist staffing by 40 positions would help reduce the caseload per worker, align more closely with staffing ratios in states with lower payment error rates, and support efforts to improve processing timeliness and payment accuracy. Among these lines will cost adding these lines will cost an additional $1,996,582 in state funds for state fiscal year 27 due to changes in SNAP administrative cost sharing. In addition to the $35.6 million savings in benefit cost sharing, these staff would lessen the administrative burden on applicants and recipients, improve our application and recertification timeliness, and reduce wait time for telephonic and in-person interactions.
Thank
And
you.
this is also addressed in the memo. the
Okay.
Explanation of the payment.
Which
error
number?
rate. And those are, let's see, the number 4. So it's split into 2 sections, one which describes the Medicaid payment error rate measurement, and the SNAP payment error rate is right after that on the following page. And much of that language is very similar, I think, to what I just read.
Yes, Representative Zager.
I don't know if you would know this, Sam, but the other special revenue in line 165, which OSR account would that be? Where?
I would defer to the department on that.
I figured.
So that is the Office for Family Independence District. That is a federally cost allocated account. So it shows as a special revenue, but that is essentially billed to the federal side. So it's a 50, well, not almost a 50-50 match.
So but it's not a federal expenditures.
It's not a federal expenditures, but it is federally cost allocated.
That probably makes sense to you, and maybe I'll learn after the fact. With that.
So the expenses for this portion of the positions are then allocated to grants throughout the department, so that revenue comes in to pay for that. So it is federal side, even though it shows as an 014.
Okay, well, thank you.
Yeah.
Representative Graham.
Thank you. This is the same question that I had. What happens if we don't reduce our SNAP payment error rate? What happens in relation to federal dollars not coming to us? Or tell me a little more about the reality of what's going to happen.
Sure. And it's really the cost sharing that was indicated in the justification. So that's what we would be able to anticipate if we're not able to get our payment error rate below that 6%, that tiered cost sharing is what we would incur.
So it's by percentage. So
Yeah.
if you read in the justification that it's tiered based on the percentage.
So this is more of a reflection, I guess, than a question. I'm trying to understand this correctly. So, in order to get our payment error rate, which is currently, looks like pretty well below the national average, down, we're investing $2.5 million so that we can realize a savings of $35.5 million. That looks about right, doesn't it? Trying to
That
get
is
some
the goal.
clarity on it.
Yes, the goal
Okay.
is to invest minimally to save
A lot.
a lot. Yes.
Sounds like a good investment to me.
Sounds like sound fiscal management. Okay,
Thank you. I'll take a motion on this. I think it's line 164 and 165.
I'd move 164 and 165 into the budget.
And do I have a second? All those in favor? And all those opposed to this?
Line 166 and 167 provides funding in OFI for postage related to HR1. So I'll read the justification for that as well. Implementation of HR1 will significantly increase the volume of mailed notices to clients due to new eligibility, verification, and work requirement provisions. Federal regulations and state policy require that clients receive written notifications for a variety of reasons, including initial notices of new requirements, requests for additional verification of documentation, adverse action notices when benefits are reduced or terminated, ongoing compliance reminders, and recertification packets. The increased costs will be driven by both postage and printing, as many notices require multiple pages and/or enclosures.
Okay, I'll take a motion. Any questions on this? Take a motion on line 166. Is it 167 as well?
Yes.
Yeah, 166, 167. Yes, Representative Graham.
Make a motion and remove line 166 and 167.
And a second, Representative Zager. Seconds, all those in favor? 7.
That's the snap.
Yeah, that's the one I've got the language for.
Yeah, wait. Well, wait.
Okay, yeah.
Opposed.
Opposed.
Opposed, I'm sorry.
Representative Daigle
Representative Daigle, are you? Yeah.
and Representative Griffin. Okay, all right.
Okay,
Line 168 and 169 provides funding for the Office of Family Independence for the projected increase in income verification services pursuant to HR1, and I will also read the justification for that. The implementation of HR1 new work and eligibility requirements will significantly expand the volume, frequency, and complexity of income verifications required for compliance. Under the new provisions, the Office for Family Independence will be required to verify earnings at additional points in the eligibility cycle, respond to new federal match criteria, and process more frequent changes reported by clients.
okay. Take a motion on 168 and 169.
I move 168 and 169 into the budget.
I'll second that. All those in favor? And opposed?
Line 170 provides funding for heating assistance benefits for SNAP participants to improve the payment error rate. And I am going to read the justification for this. Rather than authorizing the Maine State Housing Authority transfer in Maine Revised Statutes Title 22A, Section 3769E, this initiative proposes to provide the following. 1, all SNAP households with children under age 18, which is roughly 25,000 households, would receive a heating benefit of $20.01, which equates to $500,000 at certification or recertification. 2, the department would issue a $20.01 heating benefit to all assistance households without a child under age 21, which is roughly 72,000 households, for a total benefit of $1,440,720. Implementing this proposal would make all SNAP households with a member over 60 with a disabling condition eligible for the full standard utility allowance, eliminating roughly 15% of our payment error rate, and may eliminate the risk of food and nutrition services, financial penalties, and benefit cost sharing. And this is associated with language part X, which is line 185.
Okay. A motion on line
Yes.
170.
And there were questions on the memo.
Oh,
about
okay.
this.
Go ahead,
Sorry.
Rose.
Yeah. 23 and 24.
170, 23, and 24.
So it's questions 23 and 24.
Oh, okay.
Sorry,
I got a lot going on
too many
here.
numbers.
Yep.
So line 23, is, the question is explain the standard utility allowance, I'm sorry. How much is a full standard utility allowance? The department answered, since actual utility costs are often hard to determine, states may use the standard utility allowances, which are standard amounts that represent low-income household utility costs in the state or local area. Standard utility allowances may be used in lieu of the household's actual costs when determining eligibility and benefit amounts. Maine's federal fiscal year 2025 standard utility allowances were for heating and cooling. The utility allowance is $1,047. The basic limited utility allowance is $353 and the phone allowance is $60. SNAP benefits are calculated individually for each household. Because SNAP households are expected to spend about 30% of their own resources on food, benefits are based on the maximum monthly allotment for household size, less 30% of the household's net income for the month. SNAP rules allow for several deductions from income, including a standard deduction from earned income, dependent care expenses, medical expenses for some households, and excess shelter costs. Excess shelter costs are those that exceed more than half the household's income after other deductions. Allowable costs include fuel to heat and cook with, electricity, water, the
Yeah.
basic fee for one telephone, rent or mortgage payments and interest,
24.
and taxes on the home. And there was a further question, if heating is included in someone's rent payment, are they still eligible for the standard utility allowance? And the answer is yes, all SNAP households will receive the energy assistance payment.
Okay.
And again, this is line 170 and also language part XX, which is line 185.
Okay. Take a motion on line 170 and 185.
Yep, I would move 170 and 185 into the budget.
Yeah. Go ahead.
We have a motion and hasn't got a second.
I'll second.
Okay, then now the discussion.
Thank you.
Sorry.
That's all right.
Robert's rules.
Where did the $20.01 come from?
Thank you.
Thank you, Director.
What is so funny?
Thanks for the question. The short answer is that's the amount in federal statute set for an energy assistance payment in order to be able to qualify somebody for the full standard utility allowance. So the same is true for LIHEAP today. If somebody receives at least $20.01 in LIHEAP, then they will qualify automatically for the full standard utility allowance in SNAP. And so by creating these payments, here, we would be qualifying all SNAP households for the full standard utility allowance, as long as they have an elderly or disabled member in the household, which is roughly 2/3 of households in Maine. SNAP households in Maine, sorry.
Okay. Thank you. Thanks. Thank you, Director. We had a motion and a second on this. All those in favor? And opposed?
Line 171 through 173 provides one-time funding for technology adjustments in compliance with new federal regulations related to HR 1. And specifically, this initiative provides funding for minor tech changes to the Automated Client Eligibility System, or ACES, consulting services and modernization of ACES to address requirements pursuant to HR 1. And this is also related to language part B, which had multiple sections in it. They're all related to transfers from the Budget Stabilization Fund for for technology adjustments. They're just separate subsections of T.
Nothing.
Okay, we've already voted on that.
You did vote on T, yeah.
Yes, Representative Lemlin.
Thank you, Senator. I'm a little confused here. In the explanation, it says minor technology changes. $9.5 million doesn't seem like a minor technology change to me. So could somebody explain, is it that an error?
Thank you.
Thanks for the question. So there are major and minor changes related to this. That was one of the questions that was posed in the memo. There is a listing of the full technology changes, and I apologize for the scrolling, but that's it. But again, there are major and minor changes. So this one initiative incorporates several items into it. So those are all listed in there.
When we got the software Katahdin, how much did that cost to?
Katahdin?
Yeah, what was the total cost of Katahdin to put it in?
I'm sorry, I don't have that at hand.
Can you give us the question number if we have it there?
That's what I was
Oh,
looking
five.
for.
It's number five.
Oh, question
I
five.
skipped past
So
it.
you wanted to
While
come
you were
up.
flipping, they were dancing. Good job. Good
All right.
job.
Would you like me to read the answer to five?
Yes.
Technology. The question was summarize the technology needs related to HR1. HR1 establishes new eligibility, compliance, and verification requirements. Technology changes include some of the components of eligibility enrollment modernization, including a new automated client eligibility system, or ACEs, front-end user interface designed to improve accuracy long-term and reduce the payment error rate, integration of our task management system, Sybil, into ACEs to ensure we more accurately process tasks, especially income-related changes which drive the payment error rate, and intelligent optical character recognition technology for automated pay stub income record creation. Other system changes include non-citizen coverage changes, the Social Security Death Master File Review, Thrifty Food Plan system changes, able-bodied adults without dependent changes, and standard utility allowance changes.
The only other item that I would just like to point out is that on line 171, that is the federal match being allocated related to this request. And on line 172 is essentially the state funded portion, or the portion that would actually come from the budget stabilization fund. So 171 is allotting the federal match portion, and 172 is this state funded portion from the budget stabilization.
Go ahead. Senator Moore.
So then that question, had not noticed it was 14. John, no, well, 13 is federal, so what we're showing 14 is the other special revenue.
I'm
On
sorry.
line 171,
Mhm.
I was looking at the funding code.
Yes. So
It says that's a federal match.
it is the federal match. Yes, it's
But
just
it's going into
allocated through a
OSR.
special revenue account. So it's that revenue from the feds is accumulated into an 014 account. So that is
Okay.
similar to Representative Sager's question on a previous initiative.
Oh, I'm sorry. So they have told us for sure then they would provide that much money for our IT revisions.
That is the match that we expect to receive.
We expect to receive.
Yes.
Okay.
And the total cost of development for Katahdin was 19 million all funds, with an ongoing all funds of $8.8 million. So hot off the press.
Called a friend.
Okay. There's no further question. I'll entertain a motion.
What numbers are we talking about here?
We're talking about 171
Through 173.
and 1 through 173.
I would move 171 through 173 into the budget.
Okay. Mention that, and all those in favor? And opposed?
Line 174 provides funding for the approved reclass of one public health educator 3 position to a comprehensive health planner 2 position retro to February 11, 25, and provides funding for all other costs. And it does include a one-time retroactive payment as this is an employee initiated reclass.
I'll make a motion then to move line 174 into the budget.
All those in favor?
Line 175 establishes one and 176, sorry, establishes one health program manager position funded 50% general fund, 50% federal expenditures fund, Maine CDC to oversee investigations, outbreaks, surveillance and disease prevention for STDs and HIV. So you did have a question about these positions in the memo, I believe. And that is. $25. Thank you, Rob.
Question 25?
Yes. The question was, are positions for STI and HIV investigation work being reduced at Maine CDC? So the answer, Maine CDC's infectious disease prevention program ensures statewide surveillance, prevention, investigations, and outbreak response for HIV, STI, and viral hepatitis. The 2 proposed positions for STI and HIV investigation will maintain critical resources for statewide infectious disease control, including investigation of new diagnoses, clusters, and outbreaks of HIV, syphilis, gonorrhea, and chlamydia, linking individuals to testing and treatment, and promoting prevention interventions, including PrEP, syringe services, and safer sex initiatives to reduce the spread of infectious diseases. Infectious disease prevention staff resources are primarily supported through federal funding agreements with the US CDC and HRSA. Approximately 23.5 FTEs of 24 FTEs total are federally funded. Federal funding continues to be dynamic. The US CDC issued a 1-year extension of the COVID STI funding through February 28th, 27, and we anticipate reduction in disease investigation resources once those funds end.
Take a motion on 175 and 176. Representative Zager.
Mr. Chair, I move 175, 166 into the budget.
And a second. Second by Representative Brito. All those in favor? And opposed?
Similarly, line 177 establishes a public health educator 300% funded general fund to support disease prevention and surveillance for STIs, including congenital syphilis and HIV.
Thank you, Mr. Chair. We had testimony here just several days ago that the congenital syphilis rate, this is babies getting syphilis, went from 0. It was 0 for like 20 years in Maine, and it jumped up to like 104 a couple of years ago, and it remains very high. And we can't just wave a magic wand to get rid of that. We need to have programs. We need to have treatments. We need to have access to healthcare, and this is a step in that direction. So I move 177 into the budget.
And second on that.
I would second that. Alleviating the possibility of syphilis in babies seems like a good use of taxpayer dollars.
Okay. And all those in favor? 7. And opposed? 4. Okay.
Lines 178 through 179 provide funding to increase the hours of one part-time chemist 2 position in the Health and Environmental Testing Lab C's drug section from 32 to 80 hours biweekly. That would be 62% general fund, 38% other special revenue funds in the Centers for Disease Control. I'll read the justification quick. The C's drug team within the forensics unit at the Hedo Lab is currently experiencing a backlog of 226 cases for testing. With the existing state and contracted resources, the team can only process an average of 20 new cases and 55 activated cases per month. At this rate, it will take the team a minimum of 4 months to be current with testing and eliminate the backlog. This is assuming no new cases are received and no other cases are activated. Additional resources are required now to help with the ever-increasing workload. Utilizing an existing part-time position of which Hedo has been unable to fill due to it being a part-time position, provides Hedo with the necessary additional revenues while fully maximizing an existing position.
So my question is how much money are we talking about? Because there's nothing in the funding columns.
Yes, this position is being self-funded or is proposed to move funds from the all other line to the personal services line to fund this.
I'll take a motion. Representative Graham,
Make motion to remove line 178, 179 in the budget.
and a second on that. Representative Zager, second. All those in favor?
All present. Line 180 provides funding in the universal immunization programs, other special revenue funds to align with available resources, and I will read the justification. This increase in allotment fulfills the obligations as outlined in Maine Revised Statutes Title 22, Section 1066, Universal Immunization Program to purchase vaccines with collected assessments from state of Maine health insurance organizations and without the use of the general fund. To date, this fund has been utilized to procure vaccines for Maine insured children ages birth through 18. Effective July 1, 26, this fund will expand to include vaccine purchases for all Maine insured adults ages 19 to 64 and operational costs to support the Maine immunization program. The annual budget for this fund is estimated to increase from 25 million. This $10 million supplemental allocation will be utilized for immediate procurement of 6 months routine vaccine inventory and the 26 to 27 seasonal respiratory vaccine inventory for Maine adults, in addition to staffing and operational costs to support the expansion. Oh, and thank you. Also related to question 26. Wish I could read.
Please.
The question being, is the expansion of the Maine immunization program new? And is the increase for the Maine immunization program expected to be one-time or ongoing? The Maine immunization program works with the Maine Vaccine Board, an independent entity with appointed members, to make vaccines available at no cost to providers across the state through the Universal Vaccine Program. The program was established in 2010 to ensure that children in Maine had equitable access to vaccines available through the U.S. Vaccines for Children's program. It is funded by a fee on insurance carriers calculated by covered lives in lieu of billing and reimbursement by Encounter. The Maine Vaccine Board votes annually to determine which vaccines are covered under this program and the annual assessment fee to be paid quarterly by Maine health insurers. Until now, this program only covered children, but Maine recently passed legislation to expand the scope of the Universal Vaccine Program to include insured adults 19 to 64 years of age. This expansion is effective July 1, 26. Due to the changes in the amount of fees collected, dependent on the decision of the Maine Vaccine Board, changes in allotment for the program to ensure they are able to spend the funds collected are not uncommon. The volume of this allotment increase, $10 million, is larger than prior requests due to the expansion of the program in Public Law 25, Chapter 440. As a reminder, there is no general fund ask associated with this initiative.
Where's your comment? Okay. Representative Zager.
Thank you, Mr. Chair. I move line 180 into the budget.
Second.
All those in favor? And opposed.
Line 181 provides funding for ongoing support to adult treatment recovery courts in Oxford County and Region 6. I will read this one. The Office of Behavioral Health Program General Fund currently funds treatment and case management services for 7 main adult recovery treatment courts in Washington, Hancock, Penobscot, Androscoggin, Cumberland, York, and Kennebec counties. The courts in Oxford County and Region 6 have been funded through a memorandum of understanding with the Maine Judicial Branch. The AOC has communicated that the Federal Bureau of Justice funding being used will be ending September 30th, 26. And this initiative is requesting funding to be able to continue funding these 2 courts. In the most recent legislative session, legislators raised at least 3 bills, LDs 753, 779, and 1266, related to expanding courts in Maine. ATRCs are specialty dockets for eligible individuals whose involvement with the criminal justice system has been fueled by a serious substance abuse use disorder with drugs or alcohol. Individuals are admitted to a ATRC after entering into a plea agreement and accepting responsibility for their conduct. Entry into a treatment court is voluntary. Services include a multidisciplinary treatment team that includes the presiding judge, prosecutor, defense lawyer, probation officer, case manager, treatment provider, law enforcement officer, and coordinator, all of whom have received specialized training and comprehensive individuals treatment plans, including medically assisted treatment, or MIT, if appropriate.
I'll take a motion for 181.
I'll make the motion to move line 181 into the budget.
And a second by Representative Lemelin. All those in favor?
Right, unanimous among present.
Well, we got through the green sheet. We're going to take, what, a 10-minute break, I believe?
We have purple, we have the purple.
Oh, we got to do purple? Okay.
There's a couple left.
Yeah, we did most
All
of
right,
them.
let's do that.
Okay, I just want to make sure I got it. So I think the only ones we need to cover are YY, which removes the legislative requirement for the Department of Health and Human Services to provide $3 million to the Maine State Housing Authority for use in programs under their jurisdiction.
What was that?
And that was related,
I didn't find it right now.
it's but there's no idea what I'm about.
We're talking about YY, and we're looking, it doesn't show a line reference, but
It is related to the SNAP
The
energy
SNAP.
assistance
that's what we're
payment. So
talking about.
essentially, rather than providing TANF dollars to Maine State Housing to augment LIHEAP benefits, which is technologically complicated and is something that takes a lot of back end work and can contribute to the payment error rate. As you heard from Director Yaffe, we are repealing this requirement and replacing it with the energy assistance benefit that maximizes the standard utility allowance. So this is really just another part of that initiative.
Just how long have we been doing that?
I believe that started in 2017.
Wow, a long time.
Further questions? We're going to vote that line. I'll take a motion. Yes, Representative Graham. I will second that. All those in favor?
Unanimous among those present. Moving on to BBB. This BBB, line 188 on your purple sheet.
BB.
This part authorizes DHHS to adopt emergency rules to implement any provisions of this act over which it has specific authority that has not been addressed by some other part of the act without the necessity of demonstrating that immediate adoption is necessary to avoid a threat to public health, safety, or welfare.
And I think this is something we see almost every time, isn't it? That's what I thought.
It's
Pretty standard.
language to allow for.
Okay. Just in case, yeah. So I'll make that motion then that we move BBB line 188 into the budget.
And we'll take a second on that.
Second.
Second. All those in favor?
Unanimous among those present. The last one is EEE, which authorizes the Department of Health and Human Services to transfer personal services to the all other and capital expenditure line categories in order to fund the replacement of the camera and access control system at Dorothea Dix, rate determinations for main care services, and a comprehensive benchmarking analysis for Medicaid rates.
I would move that we move line 191 into the budget. Second by Representative Zager. All those in favor?
And that would be all present. And that's the green sheet and the purple sheet.
Okay, we're going to take a 10-minute break.
So it was the idea for the break that we're going to talk about amendments, or we were going to wait until Tuesday for those, or what were the plans?
I need to talk to you first.
Okay.
Yeah.
Okay.
And maybe we come back and just adjourn it, or maybe
Yeah.
we deal with this, but
Okay. We are wrapped up for today, so I'm going to make a motion to adjourn. All
Thank
those in
you.
favor of adjournment?
Oh, we have language review.
We got excited too soon.
It's all right.
So they
I don't disagree.
they are fine with the bill, with the cold.
I'm sure they are. Okay.
Well, I'm just saying, you know, because that was,
Yeah, they should be.
Yeah, they
Because
should.
it's better that way.
it is, and they get that. So we're good.
Sorry, I want to get these,
I feel like I'm in the
in
chamber.
process.
Getting all kinds of papers. Dealing cards.
So the first one I've got for you, these are all first round, so you'll see them again after their final and through the revisor's office. The first one I have for you is LD 2136, which is an act to support victims of trafficking in Maine in response to federal funding cuts. This was a divided report. This is the majority. Altipass's amended report. So this substantively does very little. What it does is it adds a section clarifying that this money is intended for Preble Street. As you recall, it was originally drafted. That information was in the summary, but it wasn't anywhere in the actual bill. So we thought it should probably be in the bill somewhere. So we did add language making that clear, and also just belt and suspenders notwithstanding the procurement.
I guess I do have a question about that, because I thought in the past, we really tried hard not to include the names of vendors, you know, that contracts are being awarded to, but we named it more of the type of business, I guess.
So I think the difference is that this is not a competitive procurement. This is specifically for Preble Street.
Wow.
Instead of it being like the department is going to give out some amount of money for X services, but we don't know who it's going to be to yet.
Okay.
Whereas this was clearly directed at Preble Street.
Okay. Wow. Alrighty.
Next I've got 2123, which is the dental bill. So you'll remember this was a unanimous report. I worked with the department on this language, so I just wanted to, I'll go through this one in a little bit more detail here. Section 1 establishes that effective July 1, 26, DHHS shall provide there's no prior anesthesia for the provision or prior authorization, I'm sorry. I'm tired. No prior authorization for the provision of deep sedation or general anesthesia for dental services. Section 2 provides that the department shall update its fee schedule and will reimburse for deep sedation and general anesthesia at 60%, 7% of the commercial medical benchmark. And that rate will be maintained until June 30th, 28, or until there is a new dental rate determination process completed. And then it provides the codes that will be used to bill for those services. And you'll see that it does include those 2 new codes for this year. The third section provides that DHHS shall provide for the following in its fee schedule. So first, that reimbursement rates for extractions billed using dental terminology code D7140 must be maintained until June 30th, 28, or again, until rates are established. So this is something that when the department had done its work looking at the anesthesia, it had built in these additional provisions into their modeling. So these rates are in effect now, and they will be maintained. Again, it's just making it clear that they're gonna keep those rates until a dental study is done or until June 30th, 28. And similarly, the current rate for caries arresting medicament, which I think that's a silver diamide.
Our dentist over there.
Oh, great, we have a dentist.
Silver diamide fluoride.
Yes, yeah. And so those rates will be maintained. also until a rate study is done or until June 30th, 28. That is the dental bill. And then you have both a minority and a majority report for LD 978. So this is the GA bill.
Gotcha.
That went to the floor and bounced back. And so you'll see that these are item numbers 5 and 6 because there's a lot of paper associated with this bill. So the majority report replaces the original bill and provides that the state will reimburse tribes and municipalities 75% of direct costs incurred on or after July 1, 2026. The minority report provides that the state will reimburse the 6 municipalities or Indian tribes receiving the highest amount of state reimbursement for the period beginning July 1 and ending July. Actually, I made a mistake in the summary, not in the actual. Sorry. It's just the summary that's wrong. I'll fix it. So for the 6 municipalities or Indian tribes receiving the highest amount of state reimbursement for the period July 1, 21 and ending June 30th, 25, they will receive 70% of direct costs, which is the current rate. And for other municipalities and tribes, those will receive 75% of direct costs on or after July 1, 26. It's after 5 o'clock, so the door locks. Yeah. That is what I have for you today. I will bring these back when they are final and through the revisor's office before they are reported out.
Thank you. Okay, thank you.
Good. Thank you so much, Sam.
Yes.
Appreciate it.
Okay, thank you. Thank you. All right.
Yeah. Let's work the schedule.
Yeah, let's do that.
Thank you to the department for your time today and
Thanks
for
so
all your
much
help.
for being here.
Yeah.
We're gonna do scheduling. Yeah.